Here are 5 USMLE-style questions focused on the high-yield features of Streptococcus pyogenes group A Streptococcus, with correct answers and detailed explanations. Question 1. A 10-year-old boy presents with fever, sore throat, and a sandpaper-like rash that spares the palms and soles. On physical exam, you note a strawberry tongue and circummoral pallor. What is the most likely pathogenesis of this condition? A. Immune complex deposition in glomeruli. B. Antibody cross-reactivity with cardiac tissue. C. Exotoxin-mediated cytokine release. D. Type 4 hypersensitivity reaction. E. Superantigen-mediated T-cell activation. Answer: E. Superantigen-mediated T-cell activation. Explanation: scarlet fever is caused by erythrogenic exotoxins, superantigens, produced by S. pyogenes, leads to massive cytokine release and rash. AB. Describe post-streptococcal sequelae like glomerulonephritis and rheumatic fever. C. Vague, not the primary mechanism. D. Type 4 is delayed hypersensitivity, e. TB skin test. A 17-year-old female presents with sore throat, fever, and tender cervical lymphadenopathy. Rapid antigen detection test for group A Streptococcus is positive. Which of the following complications is most likely preventable with prompt antibiotic therapy? A. Post-streptococcal glomerulonephritis. B. Scarlet fever. C. Acute rheumatic fever. Toxic shock-like syndrome. E. Necrotizing fasciitis. Acute rheumatic fever. Explanation: prompt treatment of S. pyogenes pharyngitis can prevent rheumatic fever. A. PSGN can still occur even with antibiotic therapy. B, D, E are toxin-mediated or invasive. Antibiotics won't fully prevent them if the toxins are already produced. Question 3. A 35-year-old man with diabetes presents with severe pain, swelling, and crepitus in the leg. Surgical exploration reveals rapidly spreading tissue necrosis. Cultures show gram-positive cocci and chains, beta hemolytic bacitracin sensitive. What is the most likely causative agent? A. Staphylococcus aureus. B. Clostridium perfringens. C. Streptococcus agalacta. D. Streptococcus pyogenes. E. Enterococcus faecalis. Answer: D. Streptococcus pyogene. Explanations: pyogenes causes necrotizing fasciitis, a rapidly progressive soft tissue infection. Causes abscesses, but not as aggressive fasciitis. B. Produces gas gangrene, not the same. C. Group B strep, associated with neonatal infections. E. Not typically associated with necrotizing infections. Question 4. Which virulence factor of Streptococcus pyogenes is responsible for its ability to avoid phagocytosis and plays a role in the pathogenesis of rheumatic fever? A. Streptolysin. OB. M protein. C. DNase D. hyaluronidase. E. Erythrogenic exotoxin. B. M protein. Explanation: M protein inhibits phagocytosis and is structurally similar to host proteins, molecular mimicry, rheumatic fever. Streptolysin O lyses RBCs. C. DNase degrades neutrophil extracellular traps. D. Hyaluronidase helps tissue spread. E. Causes scarlet fever, but not involved in rheumatic disease. Question 5. Which of the following findings would best confirm a recent group streptococcal infection in a child now presenting with acute glomerulonephritis? A. Positive rapid strep test. B. High ASO titer. C. Blood cultures. D. Positive throat culture. E. Negative urinalysis. Answer: B. High ASO titer. Explanation: antistreptolysin O and anti-DNase B titers indicate recent infection even if the organism is no longer present in the throat or skin. AD may be negative by the time PSGN develops. C. Blood cultures not typically positive in this setting. E. Incorrect. Urinalysis is positive in PSGN hematuria RBC casts. Would you like